Hello, and thank you for tuning in to McDougall's Medicine with Dr. John and Mary McDougall. I'm their daughter and your host, Heather McDougall. And tonight, just like every night, we're going to get to questions. But first, I know, Dad, Dr. McDougall, you had a
I
surprise for us. I
do.
don't even know what you're talking about tonight.
I don't either.
Well, let me see if I can get this up and going. I mean, what would be more appropriate for today? St. Patrick's Day. And what do the Irish, what do they associate with in terms of food? Well, it's a potato. So let's talk about potatoes a little bit. Let's see what we got here. All right. The potatoes come from the Americas, from Central America, South America. And actually, some of the earliest found potatoes were from 10,000 years ago, Native Americans, people who were originally, or at least some of the more original explorers of this country. And they found a potato called the Four Corners potato. And you can see why they call it the Four Corners potato, because four states come together. And that is the origin of the potato. But, that's 1,000 years ago or so. The potato moved. It was brought to Europe, brought to Asia. It was brought to Europe in about the 1700s. And as a consequence of the exportation of potatoes from, say, Peru, Lake Titicaca, which is probably the point of origin, took place, let's just like 300 and some years ago. And it changed the world. For example, when the potato was introduced into Europe, hunger disappeared. They had no more famine. And the Irish in particular were changed by the potato. Between 1801 and 1851, population of England and Wales doubled in size as the potato was introduced. They went to a population of 8 million people. But then things didn't work out too well. They had the Great Hunger in the early 1800s. And that was a consequence of an infection by the potato blight. And it destroyed their primary source of food. Potatoes were 60% of the food of people in Europe at this time. But it involved a lot of politics too. There was a possibility of feeding the Irish with other types of starches. But for whatever reason, the Irish starved. And 1/3 of the population of Ireland left and went to the United States, and many people died. I particularly liked one comment that I read about the potato, how the Irish women look so much healthier, and their appearance, they were so much more attractive when the potato was introduced. Potatoes grow almost any place. They will grow at sea level. They'll grow up in mountaintops. They grow from Chile to Greenland. They are the most productive of any of the starches. Potatoes have, let's see. Potatoes produce more calories and more protein than rice or wheat. And an acre of potatoes will feed a family of 10, and is the least damaging of all foods on planet Earth. Grows in about 50 days. It's extremely versatile. It's also extremely nutritionist. You can live on potatoes alone. You can't live on above ground storage organs like grains and legumes alone. You've got to have some vitamin A and vitamin C. But underground storage organs like potatoes are loaded with A and C. They got all the protein, all the vitamins, all the minerals, all the fats, everything you need. The potato is known as the anti-scurvy vegetable. In other words, dealing with vitamin C and preventing it. You can raise children, infants, on just potatoes alone. In this particular study of children who were orphaned, and they had to feed them what was available in Peru, and they grew these children normally, a normal growth pattern, when essentially all of their protein came from potatoes and 75% of their calories came from potatoes. That's how complete they are. Another study done in the 1920s, and I'd like you to look this up. It's about a man and a woman who were in their 20s. He was 25, she was 28. And they went into an experiment where they were housed in a metabolic ward. In other words, they had complete control of their food, and they fed them only potatoes and some fat. And they did that for 6 months. Now, these were very active people. They were marathon runners, triathlon runners, and they lived on potatoes alone. And when you read this paper, and I encourage you to do it, you can look it up. Look up an all-potato diet. It's easy. Look up Kahn, who's the author on an all-potato diet. When you read about these people, you find a couple of profound statements. They did not tire of the uniform potato diet, and there was no craving for change. They were happy just living on potatoes, as most of you realize is not a hard accomplishment. And even though both of them were physically active, they were described as in good health on a diet in which the nitrogen, which is the protein, was practically solely derived from the potato. Complete nutrition. Athletes are discovering how important a potato is in terms of long distance performance. You're told that a potato is a high glycemic index food. Well, that's what athletes want, is they want to replenish their glycogen stores for the next race. So it is an ideal food for those who want to win long distance events. It also is the most satisfying of all starches and basically all foods that you consume. This work done by Susan Holt fed different subjects foods and asked them how they felt in terms of satiety. And the potato turned out to be the most satisfying. And you've got to satisfy that hunger driver. You're not going to be in control of your weight. As far as dealing with chronic diseases, a potato is ideal. It's an ideal food on the McDougall diet. Get all the protein, vitamins, minerals, etc., food that you would enjoy. And it's made up in such a nutritional makeup that it supports your health ideally. But people have a bad attitude about potatoes. And it's not because of the potatoes. It's because of the bacon and the cheese and the butter and so on that they put on potatoes. You know, the difference between a bacon, cheese, butter potato and just the potato alone is somewhere between 174 calories for the butter and grease and so on, versus 87 calories. So it's an ideal food for losing weight as long as you don't contaminate it with butter and oil, etc. Potatoes have always enjoyed a very positive attitude about them. These are some brochures that came from World War II. Of course, during World War II, we wanted to win the war. We wanted our soldiers as fit as possible. And so potatoes were promoted as the best food for our fighting men. When people starve, potatoes are often the food that's reintroduced. And whenever a population has enough food, in particular enough potatoes, then it is a population at peace. So it's really important to establish world peace, just like it was in the 1800s in Ireland and Europe, to establish it today. We have populations of people, as you well know, who are starving and are being fed starches like potatoes. The potato was the World Health Organization decided that 2008 was the International Year of the Potato because it is so important in terms of nutrition, individual nutrition, population nutrition, and also in our future.
Look at all the different kinds.
Yeah. So paramount in the past and the present and the future. Talking about the future. What did Matt Damon in the movie about Mars, The Martian, what did he grow for a year? Potatoes, an ideal food. So this is Mother Earth. She's shaped like a potato. And one of the methods that we have to do, one of the things that we have to do to save our home is we have to take care of the energy needs, fossil fuel, transportation, et cetera. You know, the global warming gases produced by industry. We have to do that, but we also have to change the diet of people on this planet. And I've talked to you about the effect of food on reducing your personal carbon dioxide output. If you switch to this kind of diet, a potato-based diet, would be fine. Overnight, you reduce your CO2 output by 80%. I mean, half of the greenhouse gases are produced by the animal agriculture business. So the potato is really important. In the past, in the present and in the future. Call me Dr. Potato. If I only had one thing to eat, the first newsletter that I wrote when I started the newsletters back in 2002 was about potatoes, are the pillars of worldwide nutrition. There's a whole magazine that was dedicated to Dr. McDougall and the potato. You could call me Dr. Potato, as opposed to some of my competition who's known as Dr. Lard. In today's St. Patrick's Day, in today's New York Times was a story about saving our planet by geoengineering. This has been a topic that is becoming more and more discussed, but there's a lot of hesitance because we don't know what the effect of reflecting sunlight will be in terms of putting particles in the atmosphere. You know, we may end up making it so we can't grow any crops. We make the planet too hot, too cold. And so the idea of geoengineering by putting particles in the atmosphere to cool this place down has never been popular. It shouldn't be. But, and this is the slide I want to end with you, there is a way to cool the planet. And I want you to look this organization up. It's an all-volunteer organization. And what these people are doing very successfully is they're reducing the temperature of local areas by building mirrors, 10 by 10 foot mirrors that are made of plastic bottles and aluminum cans. They cost $10 a piece. And if we cover a certain percentage of our planet, we can cool things down enough so we have a chance. Look it up. I've talked to you about this website before. It's mir.org. And you need to eat potatoes. And we need to take care of the fossil fuel problems. Anyway, Heather, that's all I want to say about St. Patrick's Day.
Thank you. You
And
guys are
potato.
good. You're wearing green.
Yeah,
Well, you know, potatoes,
but I didn't make potatoes for dinner tonight. I completely forgot about it. I have this great recipe that's online called Calkaline, which is an Irish mashed potato and greens dish. And I should have done that for tonight, but I didn't think about it
yeah.
till it was too late.
You know, I tell this story that the only reason I'm alive today, you know, many of you know my history. I used to weigh 80, 90 pounds more than I weigh now. I had a massive stroke at 18. I had major abdominal surgery in my 20s. I'd have been dead if it wasn't for the fact that as a child, my mother could cook mashed potatoes. I mean, that was basically her only healthy food, mashed potatoes. And it was my favorite food. And at that time, I didn't realize how complete it was. But back then, it not only being my favorite food, I could have lived on potatoes and peas and corn, which is the meal that she prepared with a little brown gravy. But her brown gravy was not healthy. But the brown gravy you put over our mashed potatoes is really healthy. So anyway, I credit to the fact that I'm alive today at 77 years old because my mother knew how to make mashed potatoes. But besides that, she didn't know how to make much. Anyway, you're having trouble figuring out what to do to get your health back? You can live on potatoes and water alone for the next 20 years. You might add a little B12, but that's a whole nother story. Don't worry about it. You've got somewhere between 20 to 30 years to run out of your B12. A healthy person does. Somebody who doesn't have an intact gastrointestinal tract, it takes 2 or 3 years to run out of B12. You can figure out where to get B12 in the meantime. Just make potatoes a large part of your diet. And you're on the road to the appearance that you want, to losing the excess weight, to lowering your cholesterol, to having a good bowel movement, to lowering your blood pressure, getting off your drugs. You can do that with potatoes alone. Thank you, St. Patrick's Day.
So a question about those potatoes, do they have to be organic?
No. They have to be fresh, but they don't have to be organic, even though they do use a lot of herbicides and pesticides in the farming of potatoes. If you're going to eat the skin, it would be more important, I would think. But we try and buy organic foods, and we recommend organic foods, not through a loudspeaker, okay? We ask you to do a lot as far as switching from an animal food-based, oil-based diet to a starch-based diet. That's a big deal. To add, in addition, the fact that you have to eat organic, all organic, puts an extra burden, an extra obstacle in the way of making dietary changes. So even though Mary and I, we buy organic, not just for our own selves, because these chemicals, they cause cancer. They promote cancer. They cause brain damage, including Parkinson's disease. Look it up. Parkinson's disease is caused by organophosphates, pesticides. So, we do make an effort to stay away from these chemicals. But as far as teaching it, that's the next thing you have to learn. Not only for yourself, but for the farmers that have to deal with these chemicals. It's time to get a better way of farming out there. But as far as spoiled potatoes, you don't want to eat spoiled potatoes because the potato under its skin produces a poison, a toxin called solanine, which doesn't kill. Nobody dies from solanine poisoning, but you get nausea, loss of appetite, maybe a little gastrointestinal trouble. And you notice whether the potatoes are spoiled or not because they have a green layer under the skin, and you'll find buds on the potato indicating that they've been too long in storage. So what do? Well, you throw the potatoes away, or you can cut the green part out. That works out okay. So fresh potatoes are what you want. Fresh food, you want clean food, you want starch.
Thank you. Okay, lots of questions coming in the chat. Let's start from the top. Mark wants to know a cure for blepharitis, which are crusty eyes all day long.
Well, it depends on what's causing it. I'll tell you something that I've gotten a lot of objection from. It has been from my female patients, and that is I've had a lot of them come in with a complaint, and no reason a male patient couldn't come in with the same complaint, but would come in with a lot of complaints about blepharitis. And then I would tell them what they had to do. And usually the response was not pleasant. I told them they had to give up the eyeliner. These eyeliners that you put on your eye commonly cause irritation, which results in blepharitis. But, besides that, a more specific recommendation, I don't know. I think everything has to do with food, so I probably tell you to change your diet. But where I've seen blepharitis is when people have, used things like mascara on their eyes. But you also get bacterial infections and viral infections, which could be called blepharitis also. Autoimmune diseases will cause an inflammation of the eye, but we call that uveitis. And but there's no reason it couldn't affect the eyelids too, in a blepharitis. How would you treat it? Well, again, I'm thinking back to some of my plantation days 40 or 50 years ago, when somebody would come in with this particular complaint, and what we would use is Selsun Blue shampoo, because it's associated with seborrhea, which you can treat with Selsun Blue shampoo. So one of the recommendations I used to give, and I don't know whether this is current or proper these days, is we would have a Q-tip and treat the eyelashes with Selsun Blue shampoo, because this was a result of the seborrhea. They ask, what do they call it, Mary, when you, so seborrhea?
Dandruff.
Dandruff, yeah. Oh, thank you. Well, you ask, why do you get the seborrhea or the dandruff? It's the food. I'm pretty sure of that. And it ends up on your eyelashes too. You have dandruff on your eyelashes. So I don't know, you look it up before you use Selsun Blue on your eyelids.
Well, it wouldn't the soap get into your eyes though? You'd have to be really careful.
Yeah, you'd be careful.
Yeah.
Anyway, that was one of the therapies that I used to use. I don't know how much value that is really be. Doctors will treat it with steroids. You'll get steroid drops, corticosteroid drops, and that's how you'll be treated. But as far as any other treatment, I'm not aware of any that is offered by the standard medical business to treat blepharitis.
Thank you.
But dandruff, Selsun Blue is a treatment for dandruff.
Next question. This is from Kay. She's writing in. She says, every time my sister-in-law has a TIA, the ambulance takes her to the hospital, keep her overnight, and continue to run the same tests over and over. Is this necessary?
Well, it's certainly profitable. Well, is it necessary? There is a way. There's some experimental treatments out there which have caused the standard medical recommendation to be that if you have a stroke, TIA would be a prelim to a stroke, that you must get to the hospital right away, because what the doctors will do is catheterize your arteries and put thrombolytic agents on the blood clot that may have formed, which is giving you the stroke or the TIA. So standard medical therapy is to rush to the hospital for intervention. Now, why they would keep her and not do any intervention and just send her home, I don't know. But she certainly would be a candidate for eating better, because I would expect that her frequent TIAs would be reduced in number and frequency. I would think so, by improving the circulation. And I also might, if she was my patient, I might add a little bit of cholesterol-lowering medication. Why? Because that's the way I was trained. Even though the research on preventing strokes and statins is very weak, to say the least. It's just out of somewhat desperation, in addition to a strong emphasis on diet, I might put the person on a little bit of a statin, cholesterol-lowering medication. But I've told you before, I worry when somebody has heart trouble or other blood vessel troubles. I worry that when I tell you to take a statin, you look at me and you say, Dr. McDougall, if you really believed in your diet, you wouldn't be handing me a prescription. Well, I have 50 years of training. I'm a board certified internist. There are a lot of things that stick with me from my earlier education. And I'm going to use the things that I think will do you more good than harm. Now, what's totally absent from my practice, or used to be, is the importance of food. Diet therapy is not taught. Still, it's not taught. And diet therapy is the most potent therapy there is. Why is it not taught? Because there's no money in it. Where's the money? Drugs and intervention and devices. That's where it is. And that's where the education comes from. But you want to talk about powerful medicine, and those of you who have followed us or have any bit of association with us in a positive direction, you know this to be true. You are probably sitting there saying, Dr. John and Mary McDougall and Heather are under exaggerating the benefits that I received and you're likely to receive. We don't have to oversell this. This is a huge change. You get huge results. Can you imagine going, what was that dinner we saw last night, Mary? What was on television?
Cheese, the new cheese, the fried chicken.
Was it a pizza place that was putting it out?
Yeah, no, I don't know.
Maybe Pizza
Yeah,
Hut?
I think it's Kentucky Fried Chicken.
Kentucky Fried. Oh, tell them about the dish.
They fry a chicken, they flatten a chicken patty out, probably a chicken breast. They fry it, and then they cover it with tomato sauce and mozzarella cheese and pepperoni, and they bake it in the oven, and it's called a cheese, I don't know, chicken Rhea, or I don't know.
In other words, the slab of chicken replaced the bread that is usually present in this kind of dish. Can you imagine? This is what people eat. This is why 91% of people are too fat for their health. This is why half of the population is pre-diabetic. This is why 8 billion people on this planet, all right, are obese. That's why, anyway.
Well, it's something new that just came out,
I
so
know.
it'll be on everybody will see it on TV.
But can you imagine changing your dinner plate from these kinds of items to a baked potato or 2 or 3 or 10 or a plate, 2 or 3 plates of mashed potatoes? You say, well, that doesn't appeal to me. And a piece of chicken does. If you think chicken is appealing and you can eat it, the reason they put the cheese and the sauce and everything on top of the chicken is you can't eat chicken.
Yeah, they fry it first.
Yeah.
Fry it first with all this breading.
I challenge you, eat a piece of chicken. Okay, it doesn't have to be raw. You can boil it. It's disgusting. Anyway, what you do is you take the flavorings that you might have put on this exorbitant dish that Mary just described, and you put those kind of flavorings over baked potato. Tell them some of the things that we use on potatoes. You think of any salsas?
Oh, salsas and brown gravies, the creamy golden gravy.
Yeah, that's in our recipes. That's a recipe worth dying for. People who used to come to our program at St. Louis Hospital used to say they'd like to have a glass full and drink that stuff. It is so tasty. They're golden gravy.
Yeah.
Very healthy too. So anyway, you should expect to get very dramatic results when you make very dramatic changes to your diet. But as far as this TIA question, there's much more that could be done to help also your mom or your sister, and that is to fix the problem. It's the food, at least in part. Okay, should she be taking some aspirin or blood thinners? Again, that's been a standard recommendation, but not so much anymore. You know, there's not a strong push to take blood thinners or aspirin when you want to prevent a stroke or you have TIAs. But that may be another part of the program that's added. So you've got some things that are of questionable value, like cholesterol-lowering drugs, statins, and blood thinning drugs like aspirin, of questionable benefit. And then you've got something that's of definite benefit, which is a healthy diet. So you choose. I know I'd rather take the pills, doc.
Thank you. Next question. Can people with diabetes eat lots of potatoes?
Absolutely. In fact, one of the slides that I could show you, in this set that I picked, the presentation I gave you tonight, one of the slides was just how beneficial potatoes are in curing type 2 diabetes. Type 2 diabetes is the most common kind of diabetes. It's what, say, 90% of people who have diabetes have, 95%. And it is a condition that occurs as a consequence of gaining fat. You become overweight, too fat. And your body says, hey, you're fat enough. I'm not going to let you gain any more weight. So what the body does is it develops insulin resistance. So your blood sugar goes up and you're diagnosed as type 2 diabetes. Well, if you take this need to make the adaptation away, in other words, you lose the weight, it goes away. The results are with bariatric surgery. That's where they cut your intestine out. No change in diet. With bariatric surgery, they get a cure rate of nearly 80% of type 2 diabetes. You could cure type 2 diabetes with a low-carb diet just by losing weight. You could take Ozempic or AbbVie's GLP-1, and when you lose weight, you cure type 2 diabetes. I can lock you up in a jail. I can wire your teeth together. When you lose weight, you cure type 2 diabetes. The most effective way to lose weight permanently is to introduce starch in your diet, and potatoes would be an ideal starch.
But you know why they're asking that?
Why?
Because of the glycemic index of the potato.
No, that is for sure.
Yeah.
Let's just take a minute on the glycemic index. This is something David Jenkins in 1982. He's a sort of a friend of mine from University of Toronto. He developed the glycemic index, published in 1982. And what he did is he fed people various foods and then saw what happened to their blood sugar over the next 120 minutes. All right. Well, you feed foods that don't have any sugar in them, which are animal foods, meat, poultry, fish, cheese, almost no sugar at all in cheese. When you feed these low sugar foods, then the blood sugar doesn't go up much. Whereas when you feed sugar in your foods, carbohydrate, starch, the blood sugar goes up. But is it a bad thing to happen? No. When you eat, that's what's supposed to happen. Your blood sugar goes up, so you satisfy your appetite and you provide energy for your body to run on. Now, let's look at how the glycemic index is valued. What David Jenkins did is he made white bread or white table sugar the standard. All right. And that means 100%. That's the glycemic index is 1 or 100%. And then he compared eating various foods. And when you feed potatoes to people, compared to white sugar, which is 100%, they're 118%. Oh, you go bad. Well, if you feed Snickers bars to people, the glycemic index is 67%. And probably the lowest glycemic index food I know of is fructose. The glycemic index is 20%. Well, a high fructose diet is not only associated with obesity, but heart disease. So glycemic index is just one quality of food. And it has misled so many people. You eat for calories and to raise your blood sugar. That's the way it's supposed to work. And like I say, you don't raise your blood sugar at all when you eat animal foods, but you raise your blood sugar a lot when you eat starch, a lot, 18%. Eat candy bars, you lower it 40%. I'm serious. Chocolate cake is a glycemic index of 35%. It has confused so many people. Anyway, that, I guess that's why they think potatoes are bad.
That's what you always hear.
And they
that
say
about
potatoes are fattening too.
Yeah.
But a baked potato is like 100 calories,
Yeah, but
150
the
calories.
reason the baked potatoes are fattening because of that picture that you showed that had cheese and bacon and butter on top of the potato.
Yeah. Let's just say medium-sized baked potatoes like 100 calories. You know, I burn 2,000 calories easy on a quiet day. That means I got to eat 20 potatoes. You know, I've had people come to see me in my office and say, "You don't understand me, Dr. McDougall. I got an eating disorder. I can't eat potatoes. I'll eat them until I become obese and sick."
Ha!
Well, I'm going to tell you, I've challenged people with this attitude to eat a bushel basket full of potatoes. Go ahead. See what happens. Never has anybody able to meet the challenge. They can't eat that much food, and they end up with some very positive things to happen to them. Anyway, the average Irishman back during this time in Ireland, the 1800s, ate 10 pounds of potatoes a day. Yeah, but that's what they had. And again, you know, the women are described as particularly attractive when the potato was introduced into Europe. When the potato was introduced into Europe, famine disappeared. They doubled the population of Ireland in 40 years because of this source of wonderful calories. Potatoes are going to save not only us individually, but I believe the planet, as I've shown you. It's the best starch there is. But, you know, all starches are good.
Thank you. Let's see. Next question. Cheris wants to know what you have to say about keeping your system alkaline and the best way to do that.
Well, this is important. And a lot has talked about it. Do you want to follow an alkaline diet? Okay, the reason is because the body maintains a certain acid-base level. It's called a pH. And the pH of the body is 7.4, which means it's slightly alkaline. When you get below 7, then you're dealing with acid. Animal foods are acidic, and they dump an acid load into your body. For example, let's see, the acid load of cheese is 10. The acid load of spinach is minus 35. It's alkaline. So when you eat these foods, which would be meat, shellfish, fish, poultry, you take in a lot of protein. Protein is made of amino acids. Animal proteins have a particularly strong kind of acid that is, through metabolism, is released. And this is sulfuric acid, because animal proteins have amino acids called sulfur-containing amino acids. So by eating the Western diet, you dump all this acid in the system. You will die if you get away from that ideal pH of 7.4. Life is not compatible. And so what the body has to do is adapt. And the primary buffering system of the body is the bones. Every medical student learns this. So the bones dissolve, which weakens your bones, gives you osteoporosis, and then the bones solidify in the kidneys and gives you calcium-based kidney stones. So yeah, you want to eat an alkaline diet. Our diet is an alkaline diet. You know, I told you that rice and beans and so on have an acid load of 1. So they're slightly acidic. But cheese is 10. Fish is 9. In other words, 9 or 10 times greater. The body can handle an acid load of 1. You know, and we know that because of Asian populations who eat rice-based diets. They have no trouble with an acid condition and losing their bones. So the metabolism of the body can handle a little bit of acid, but it can't handle the acid load that is dumped into your body from animal foods. And our vegetable, like potatoes, are -5, so they're alkaline. Tomatoes are -56, so they're very alkaline. And so we make minestrone soup, and we put some rice +1 and some beans +1, and then we put spinach and tomatoes and potatoes, and we end up with an alkaline soup called minestrone soup. So yeah, you need to eat an alkaline diet. And the way you do it to preserve your body's health, it's just not the bones and kidney stones. This effect is all over the whole body. Not necessarily because of the acid, but because acidic foods are so harmful. They have no fiber. They're high cholesterol. They're high in fat, high in environmental contaminants. These are your animal foods. Isn't it nice that it's so simple? It's so simple. You need to avoid two poisons: animal foods, in other words, parts of animals and secretions of animals, and free oils. Those are your two food poisons. And some of you are sitting there thinking, well, what's there left to eat? That's my whole diet, is animal foods and oils. What you need to learn is that the human diet is starch. We are starch eaters, starchivores, starchitarians. We live on potatoes, rice, corn. 99.99% of the people who ever walked this earth obtained the bulk of their calories from starch. Still today, well, not today, it's changing, but up until recently, half the world's population lived on starch-based diets. But you've seen what's happened to Mexico and South America, Chile, Argentina, all over the world, Japan. They've given up their starch-based diets in the last 50 years. And look what's happened to their health. Obesity is rampant. Heart disease is an epidemic. You can see this. Anyway, potatoes are an alkaline food. If you eat potatoes, you'll become alkaline, and you'll be on an alkaline diet, and your body be so happy.
Great, thank you. Okay, next question. How can someone cure fatty liver disease?
It's cured by not eating fat. The body, when you eat fat, it stores it in various locations. It stores it in your buttocks, thigh, and abdomen, right under your skin. You can see that. You have no problem understanding that the fat you eat is the fat you wear. Well, the fat is also stored in your organs and in your omentum, which is a part of your abdominal cavity. You get this apron of tissue that when you cut into somebody's abdomen, it's just a bunch of fat flowing out. And the liver's full of fat. Everything's full of fat. So what you do is the same thing you do to help the fat in your buttocks, in your thigh, your abdomen. You just lose the weight. And it goes away. Does it always go away? Yes, it always goes away. Can you just substitute animal fat for vegetable fat? No, you can't. When you feed omega-3 fats to people with fatty liver disease, the disease does not improve. Why? This is because it's fat stored in the liver, which irritates it. So you may be left with a residual. That's the problem. From fatty liver disease comes inflammation, which lays down scar tissue, which means cirrhosis. And they say that people can die of cirrhosis from their diet, from fatty infiltration of the liver. Fatty infiltration of the liver occurs in about 30% of the diabetics, maybe more. So it's become an epidemic. Where again, talking back to my early career, I never saw this condition, but it's epidemic today. And what I would see a little touch of fatty infiltration and irritation. I'd look at the blood of people, and you could still do this. Look at the blood of people, and enzymes that are released from an inflamed liver, SGOT, SGPT, GGT, etc. These enzymes are elevated when there's inflammation of the liver. So that indicates that you have fatty infiltration. Then you can go on and you get a sonogram done. Then they can see the liver is swollen with fat. Just change your diet. It always goes away. But again, you better hurry up and do it because you don't want to get cirrhosis.
Thank you.
There are no fat people on starch-based diets. You can't have fatty liver disease if you eat a diet of rice and corn and potatoes. It just doesn't happen. Just like you don't have obesity. I mean, think about your relationship to people in Asia. Not the ones today, but like 50 years ago. Do you remember any fat people in Japan or China or Korea? If you're old enough, you don't, because there weren't any, except for the sumo wrestlers who are fed a special diet in Japan. They got fat for a reason. So you see it, and you see what happens to Asians who become wealthy. They're in your neighborhood. They're flying with you on airplanes, and usually the first class seats. Just see it, open your eyes. When they give up the starch, they give up their health. and their personal appearance. And it's so easy to turn this around. Just one U-turn. That's it. One U-turn back to the diet intended for people, the traditional diet for people, which is starch. But you wouldn't know that based on the advertisements from the food industry.
For sure.
Or from my colleagues who don't have any education in nutrition. You realize that that diet therapy is not taught in medical schools. The little bit of nutritional advice that's given to medical students and residents is about biochemical formulas, not about how you cure liver disease or kidney disease or atherosclerosis. In your whole 4 years of medical school, you get, 3 hours on average in 4 years. So the young doctors, older doctors don't know either. They don't know nothing about food. You could see that by the recommendations that come from my colleagues. Well, some of them say you should eat a low-carb diet. Some say a vegetarian diet. Some say it doesn't matter. Some say it doesn't matter. All you got to do is take these GLP-1 agonists. The problem is a lack of drugs. And you rely on these people for advice for your health? I used to joke, because it happens so often, is the patients I would take care of would often see cardiologists. And a comment that they would make is, do you know how fat that cardiologist was that you referred me to? My colleagues don't even take care of themselves. How do you expect them to take care of you? It's not done intentionally. It's, you got to make a living.
Well, they don't know, or they're ignorant, or
Well,
they don't read the literature.
But the reason they don't know is because of financial incentives. If doctors were paid for keeping you healthy, which I hear they used to do in China, if you stayed healthy, your doctor made a good living. But if you were sick, he didn't, or she didn't. If you were paid with that in mind, that money came from healthy people, then there'd be a whole different.
Change,
things would change actually. So
Thank you.
it's just money and people.
Next question. This is from Carlos. He had an ultrasound to his heart. They found calcification in one neck artery. He's been on the starch solution for 4 years, and he's still wondering why he has this calcification.
Calcium. Okay, the calcium is a part of the inflammatory reaction. All right. When you constantly irritate a part of your body, it becomes inflamed. It's low-level damage. It becomes inflamed. And the next step in inflammation is scar tissue is laid down. And with that scar tissue, the body lays down calcium. You see this in other circumstances, which this will help you understand. If you have pain, say, in your shoulder, in your bursa, in your tendon, and the doctor takes an x-ray, what the doctor will see is a calcified bursa or a calcified tendon. If you were taking care of tuberculosis patients, the diagnosis of TB is maced by a chest x-ray that shows miliary, in other words, thousands of calcifications. That's how you diagnose TB, or at least one of the criteria. One thing you do, if you get a mammogram, and the most common thing the doctor will tell you and scare you is that you have calcification of your milk ducts. This is from chronic inflammation of the milk ducts, and goes from inflammation to scar. It contains calcium. All right. So you have arteries that have calcium in them. This is because of the way you used to eat. That calcium is there forever. It's never going to go away as far as I know. So you just don't want to lay any more down, or you don't want to cause any inflammation, which results in pustules that pop and cause the blood to clot, which gives you a heart attack. Now, you've been through that. If you haven't, see my lecture on heart disease. So, hey, look, I had a heart scan done about 35 years ago, maybe 40. My brother's a doctor. He was working in a hospital that had one of these heart scan machines in a clinic. And so Mary and I both had heart scans. The technician said, Mary, I'd like to talk to you first. Oh, you have a beautiful heart scan, she told Mary. And then she said to me, I got bad news for you. You've got a calcium score of 300. That means you have horrible atherosclerosis. I said, I know I have horrible atherosclerosis. I had a stroke when I was 18. My cholesterol used to be 335. What do you expect? And of course, the reflex then is for the technician or doctor to say, well, you got to go to the heart surgeon. Next step is an angiogram. Next step is heart surgery. And that's what happens to basically all of you. But it didn't happen to me because I knew differently. I knew my previous behavior had caused inflammation of my arteries, which gave me the stroke, gave me the calcification, and that I don't eat that way anymore. So that was when I was probably 35 years old. I'm now 77. If it wouldn't have been true that I could do something about this by changing the cause, then you wouldn't find me jumping around at 77 years old with no chest pain.
You'd be dead.
They did. I had heart surgery in my late 30s. I swear, folks, I am an example of what you can do to destroy the body with enthusiasm for rich food. But I stopped all that nonsense when I was about 28 years old because I learned from my sugar plantation doctors. You all know that story. My sugar plantation, I was a sugar plantation doctor. I took care of 5,000 Filipinos, Chinese, Japanese, and Koreans who lived on rice-based diets, or at least the first generation did. And they'd never had the problems I learned about in medical school. They never had heart disease, diabetes, breast cancer, colon cancer, prostate cancer, rheumatoid arthritis, etc. Never. That was my first generation. The second generation, they got a little fatter and a little sicker by the time you got to the third generation. And I was taking care of all three generations. I was their family doctor. You ended up with people who were similar to Americans because they started eating the American diet. I knew that. So when I was told that I had a horrible artery disease with horrible calcification, I didn't even blink. I didn't spend a minute worrying about it because I knew how I got into that kind of trouble. And I knew, and I'm right, my history proves it, I knew that I could fix this problem, and you can too. But you can't keep shoveling the cholesterol and fat into your artery walls. You'll get inflammation, which leads to ruptures, which kill you, cause blood clots to form, and also lead to scars being laid down with calcium in them. It's called a heart scan, and a calcium score. They're very popular. Your doctor will give you one if you want. I caution you about getting one because it doesn't result in better outcomes. And plus, the two things can happen when you get a heart scan. Okay, two things can happen. One is you can be told that your scan is perfectly normal, you have nothing to worry about. That's bad advice because it's not the calcium deposits that kill. It's the invisible pustules that lay right next to the calcium deposits and scars that burst open and cause a blood clot to form that kill. So you can have a perfectly normal heart scan. Perfectly normal heart scan, and you've missed the killing lesions. They don't show up. All you see is old disease. So that can be a disservice to you. The other thing, if you have a positive heart scan, you're very likely to end up in the business. The heart scan is, it's a siphon to the cath lab.
A moving walkway.
The treadmill is called. That's what a treadmill is. It's a conveyor belt to the heart surgery lab, heart surgery suite. Mm-hmm. And the catheterization is the siphon that drags you there. Look, if you know what's going on, you have a chance of changing things. But you have to have the information first, and that's why we come to see you every Sunday night at 5 o'clock, is to give you at least a glimpse of the information. That's why Mary and I have written 13 national best-selling books, because you have to start with the information. That's why we run these 12-day programs. We've run programs for 37 years, hospital-based programs, resort-based programs. Now we run a telemedicine program because you need to have the information. Plus, you need a little medical care, which we also offer. We're running a 12-day program right now. We've got 50 people in the program, and here it is about the 10th day. They are all feeling phenomenal. They just, and they're about ready to get their blood tests to see they drop their cholesterol. They've gotten their blood sugars. They're all down. They're off 90% of their medication. 90% of the medication they've reduced or stopped. That's what our data shows. So here they are at 10 days, and they've already appreciated these results. The body heals quickly. But you need some education. You need a little bit of medical supervision if you're on drugs. But otherwise, the information is on our website and it's in YouTube videos and it's all there for you. And then there's something else you need to do is you need to like yourself. Because what I found is that people who don't like themselves do things like smoke cigarettes, drink a half a bottle of whiskey, and drive without their safety belt. But us people who really enjoy life, get a big kick out of it, we don't do those things. I like myself. I like Mary too. She likes herself too. But there's a lot of self-destructive people out there, and I've never been able to help them. I've turned that over to Dr. Lyle, our psychologist, to get people who don't like themselves to like themselves. I wonder how he's doing.
Thank you. Let's see. Lots of questions coming in. I only have 10 minutes left, so I'm not going to be able to get to all of them. But
let's go through a few.
Okay.
I had a whole stack of research articles I was going to talk to you about before I realized it was St. Patrick's Day. So next Saturday, we'll go through a whole bunch of
Next Sunday,
current information, next Sunday at 5 o'clock, about research that's come out, which confirms what I've been telling you. The truth don't change, folks.
Yep. Okay, next question. This is from Mary. She's wondering if someone can get off of blood thinners if they start following the McDougall program.
Well, depends on why you're on. If you are on for atrial fibrillation, which is the most common reason people are on Eliquis or Coumadin, is atrial fibrillation. But there are other reasons. You can have blood clots in your legs and you're on blood thinners for that. So what you need to do is look at some of the research that tells you whether there'll be more good than harm done. If you have blood clots, say in the legs, then the duration of blood thinning is no more than a year. And then it should be stopped. Of course, if you change your diet, which causes the blood to want to clot, the animal fat does, then you put yourself in a situation where likely you'll have no problems that require blood thinners. 1 year. But I have patients all the time come see me. They've been on Coumadin or Eliquis for years, but the research says a year's enough. And the other condition that when it comes to the atrial fib, there's something called the CHADS score, CHADS. That's the acronym. CHAD score. Look it up. It tells you whether or not you are a candidate for blood thinners. Healthy people are not. More harm is done by giving blood thinners than benefit for healthy people. But for sick people, then the benefits seem to outweigh the harms, but not by much. So you ask if going on the McDougall diet, you can stop blood thinners. Well, if you lower your CHAD score, you can't lower your age. You're stuck with that. You get a couple points for that. You can't lower whether or not you've had a stroke. You get a couple of points for that. But you can lower your blood pressure and your body weight and your cholesterol. There are so many things you get points for on the CHAD score that you can fix. And then when you fix these things, you have a low CHAD score, blood thinners aren't indicated. So yes, you could get off blood thinners by becoming healthier. And our diet is the way you do it. Or you can just talk to your doctor about the research. Say, do you have evidence that more prolonged therapy will be a benefit? And the answer is, no, that's not what the research says. A year is enough. And when it comes to atrial fib, only sick people benefit from blood thinners.
Thank you. Next question. This is from Peter. He wants to know if a morbidly obese person is going to be eating a large calorie deficient diet for a long time, over a year, does any special attention need to be given to protein intake?
Not at all.
why would you eat a calorie deficient diet?
He's not eating food. He's not eating food. He's starving.
Oh, well,
Well, no,
our
but if you're
diet-
eating our program, you're eating a low calorie dense diet, not, I guess, deficient, maybe a low calorie diet, let's say.
Well, you realize that you will become protein deficient, fat deficient, vitamin A deficient, vitamin C deficient if you don't eat. Okay, but if you eat complete foods, you never run into these problems, in particular protein. The science says that the need for protein is so low in the human being that it shouldn't be considered It's virtually impossible to eat a diet too low in protein. So, this has been built up by the protein and calcium industries. They're telling you, and they told my parents, there are only two nutrients you have to worry about, the protein and calcium. Why? Because they want to sell milk and meat. There's no such thing as protein deficiency. There's no such thing as calcium deficiency. I know you're thinking osteoporosis. We'll get into that later. I told you about that just a few minutes ago. It's due to an acidic condition, which dissolves the bones. That's how you get osteoporosis. So in answer to your question, as long as you get an adequate, well, see, he asked me, I did get an adequate number of calories. I can't answer the question totally. If you don't eat at all, you'll be deficient. As long as you eat enough to satisfy your calorie needs, it's impossible to become protein deficient. The foods are so well put together. So I guess the way they ask the question puts me in a situation where I really can give no more definite answer than that.
Okay, thank you. Next question. This is from Cetan Anarchist. My cousin has been plagued by endometriosis, but treatment hasn't helped. She does have her uterus. Will a starch-based diet help?
I think so. I'd have to look at what research has been published on changing the diet and losing weight and the effect of endometriosis. Endometriosis is a condition that occurs as a consequence. It's in women. It occurs as a consequence of their diet, which produces hormone imbalances, which cause the endometrium, which is the tissue on the inside and lining of the uterus, to grow outside of the uterus. So it grows inside lining of the uterus because that's the bed in which the fertilized egg implants. And every month you shed the endometrium. That's where it's supposed to grow. But if you're unhealthy, eat an unhealthy diet, that endometrium spreads throughout your abdominal cavity. And now you got little bits of endometrium on your liver, on your spleen, on your omentum, and it hurts and it bleeds. All right. So can you get rid of it? Again, I'd have to look at the research to see how much research would support me saying you can. I'm pretty darn sure you can improve your condition. There's less pain, et cetera. I can also tell you about a couple of women in my practice. These are just cases, but a couple of women who were infertile due to endometriosis. And one of them, Paula, brought her 12-year-old son on one of our adventure trips. Do you remember that, Heather? Yeah. So it's caused by diet. You've got every reason to change your diet. You've got no reason not to. Diet has no adverse effects. It cuts your food bill. It's kind to the planet. Animals love it that you won't eat them. So give it a try. And there's a lot of reason that if you are strict with the diet, you'll get dramatic improvement. But there's a lot of scar tissue laid down. So, there may be some permanent problems that you can't fix. But the active disease, I think you can quiet it down with a good diet and weight loss. See, because fat makes estrogen. So the fatter you are, the more estrogen you make, the more imbalances you create. And that's why I say you have to change your diet and lose the weight, because you have to get rid of these estrogen factories known as body fat cells. So, there's the challenge. Follow the diet, get to trim body weight. Now let's see how you're doing. I bet you're going to be doing really well.
Okay, thank you.
No reason not to.
Right? It can't hurt. Let's see if we can get a quick question, and we've got just a couple minutes left. Jenny wants to know of a natural way to help your thyroid.
There is none that I'm aware of. I mean, you could, if you had iodine deficiency, then you could take iodine, but iodine deficiency is so rare. Most of the thyroid conditions are due to autoimmune thyroiditis. It's an autoimmune disease, which I believe is caused by eating foreign thyroids, pig thyroids, cow thyroids. The body recognizes these thyroids tissues as being foreign. It makes antibodies to them, which attack your own thyroid gland. Your next question is, how do you eat pig and cow thyroid glands. It's called hot dogs. It's called sausage. They waste nothing in a slaughterhouse. So this autoimmune reaction kills the thyroid gland. It's dead. It's not coming back. It's gone. Now you can stop the progression by stopping the autoimmune reaction, but what you've lost is history. And what I do is what every other doctor does is I give you a supplement, which is thyroid hormone, which is Synthroid. And it's one of the safest, most effective treatments that I as a doctor have to offer. Inexpensive too. It was like $10 for 90 pills.
Okay, perfect
Anyway,
timing,
happy
6
Sa-
o'clock.
Happy St. Patrick's Day. I hope you enjoyed my discussion of the potato. And if you did, and you want to spend the next month or even the next week on an all potato diet, it'd be just fine. You'll be just a little healthier. And you have the references there, so you can look up the research that I'm talking to you about. All right, see you next Sunday. When are you going to run the next program, Heather?
May 10th, we're already filling up.
Oh,
All right.
well, we're there to help you, okay? All right, see you
Absolutely.
next Sunday, 5 o'clock.
Thank you all for